questions.
Well, thank you, Mr. Chairman, and thank you to witnesses for joining us today. Last year, when Yuma Regional Medical Center fell victim to a ransomware attack, 700,000 patients were notified that their personal health data had been stolen. But when a hospital is hacked, it's not just Arizonan-sensitive data that's placed at risk. Particularly in rural communities where alternative hospitals may not be available, crippling cyber attacks can literally be matters of life and death. This is also true in other healthcare contexts. Last year, the National Suicide Hotline was brought offline by a cyber attack, resulting in an entire day where Arizonans facing mental health emergencies could not call 988 and receive the support they needed. So my first question is for Mr. Drayson. Imagine looking in the eyes of a parent whose child may have called the suicide hotline on December 1st, but wasn't able to get through due to the cyber attack. I'm committed to ensuring that our nation's suicide prevention system is better prepared for the next attack. So the question for you is, what lessons should other public health stakeholders take from the hack on the 988 lifeline?
Thank you, Senator, for your question. It's unfortunate the event on the 988 attack was a sobering reminder of the impact to critical healthcare services when cyber attacks have successful outcomes. It reminds us all of the importance of being very aware of the risks we face as a healthcare sector to deliver those services, the need to have an adequately funded and staffed team that can implement the protections to protect us, and the understanding that we can only do so much to protect us and can't eliminate all risk, and so it requires the partnership of the government to help us provide additional protections, increasing risk and consequences for those who attack us, and the understanding and the support when we are attacked that we're the victims, and help us work through that process and don't penalize us for being attacked.
Thank you. Ms. Pierce, a few years ago, hackers took Wickenburg Community Hospital, the only hospital in a small Arizona community, offline. Fortunately, the talented IT team in Wickenburg had backed up the hospital's data and then worked around the clock to quickly rebuild their system from scratch. But not all community hospitals or other rural or tribal healthcare providers are so fortunate. Many simply do not have the resources or the cybersecurity expertise to quickly recover. So given your experience with the rural health system, can you discuss some of the unique cybersecurity challenges that are facing smaller hospitals?
Thank you for the question. I think that smaller hospitals have a varying degree of ability to recover from those attacks. One of the things that's imperative is that the attacks are identified and remediated quickly. So I'm not aware of the particular attack you're speaking of, but I would imagine that they identified quickly that there was an issue, took things offline immediately, and were able to restore from backup. Many times cyber attackers have been within the network and been able to not only compromise existing systems, but have also compromised the backups. So the challenges can be extensive in recovery to that, and we've seen some health systems, even larger systems, take weeks, if not months, to recover. So I would say that there's no one answer to that. It's there's just a wide range of abilities and talent within rural communities, and I think that your particular hospital was the exception, not the rule, when it comes to cyber attacks.
Thank you. Mr. Garcia, today ransomware attacks against hospitals are mostly financially motivated, but tomorrow cyber attacks may target specific patients with the intent to kill or injure them. As more Arizonans receive wireless medical device implants, the possibility that a hacker could disable a pacemaker or manipulate an insulin pump is something we need to take seriously. So how could public and private sectors get ahead of this threat and ensure that wireless medical devices meet the most rigorous cybersecurity standards?
Yeah, that's a very good question. Thank you, Senator. There is a lot of work being done in ensuring the security of a variety of connected medical devices, wireless and wired and otherwise. The idea of pacemakers and such, the one issue about that is it is one of those low probability, high impact kinds of events. You have to be right next to somebody with a phone to actually communicate with the pacemaker. I think what we can...
Right now.
Yes, right now. And what we're concerned about, however, is a much broader attack where patient data can be corrupted in a much broader scale within a hospital system so that anybody who is being treated in the hospital can be given the wrong dose of medicine or the wrong treatment based on corrupted data about their specific patient data. That's the much higher risk that we need to be concerned about. Meanwhile, the medical device industry, through the Sector Coordinating Council, is working hard to develop standards of practice for how you design, develop, manufacture cybersecurity into medical devices, connected wirelessly, Bluetooth, whatever, from the ground up, so that they are secure by design. That is an ongoing and long-term program that that the medical device community is acutely aware of.
Thank you. Mr. Drayson, if a ransomware attack affects an emergency room, even if we're able to restore those systems within 1 hour, some patients may not live that long. So this sense of urgency incentivizes hospitals to pay ransoms to hackers, something, of course, that the FBI and CISA advise against. Although paying may protect specific patients and hospitals in the short term, it also, of course, guarantees and perhaps incentivizes that hackers will continue targeting hospitals in the future. So how do you believe that hospitals should navigate the decision of whether or not to pay a ransom? And how can the federal government help hospitals enhance their cyber attack prevention and mitigation capabilities so that the question of whether to pay or not to pay becomes irrelevant?
It's our policy to align with the FBI guidance to not pay ransomware, and so we do everything we can to mitigate the risk that that's going to happen. We do that by evaluating the risks we have to our organization of a cyber attack, making investments with our leadership support to ensure we have protections in place to reduce the likelihood that that's going to happen. So the support we can gain from the government to help further mitigate that risk is improved threat intelligence sharing that's actionable and near real time, so we can have the most up-to-date information available to us to help protect us, as well as, again, reinforcing educational programs that can help train qualified staff that we can have work with us to ensure we can implement the best practice recommendations to protect our organization.
Thank you. Thank you, Mr. Chair.
Thank you.